A total hip replacement is essentially replacing the arthritic or worn out bearing surfaces of the hip. So again, you have the cup and you have the ball. The cup and the ball generally wear out together, one sometimes to a greater degree than the other. A hip replacement, what that is going in there and putting a new cup with a smooth surface, oftentimes either metal, cobalt chromium, or plastic, polyethylene. And then the ball is generally either metal, again cobalt chromium, or ceramic. And the reason we choose these surfaces is because they're the smoothest surfaces that we have and they have the lowest wear rate. You know, it's kind of essentially ice sliding on ice. In the hip replacement, what we do is we go down through muscle intervals down to the hip joint. We take the ball of the hip out, the arthritic portion, and we take the cup and we put a metal cup into your native cup or your bony cup, and that basically gives a backing for that smooth surface. Now, once you kind of pop the hood and replace the parts, you can, interestingly enough, close the hood and patients can get up and walk on it right away. I think hip replacements are done for a number of reasons. Predominantly arthritis, and there are various types of arthritis. Most commonly would be osteoarthritis, which is kind of the wear and tear arthritis. There are other types such as rheumatoid arthritis, which is kind of an inflammatory or autoimmune type, and there are various derivations of that that are related, such as psoriatic arthritis or other inflammatory pathologies. And you also have post-traumatic conditions. One case in point would be, say, Bo Jackson, where you have a hip dislocation, you lose the blood supply to the ball, and over time the ball collapses. You no longer have a ball and socket joint, and so you get very accelerated wear. And so hip replacement is one of the top 3 elective non-cosmetic surgeries with the best patient-reported outcomes.